Hi, I'm Dr. Sharbel Hashul, and today I want to help take some of the mystery out of one of the most nerve-wracking pieces of paper you might ever receive, your pathology report after a breast biopsy. If you've had a biopsy, you know the wait for results can feel like the longest part of the whole process. And then the report finally arrives, full of medical terms that can feel more confusing than comforting. So let's walk through what's actually in there in plain language. First, understand what a pathology report actually is. When tissue is removed during a biopsy, it's sent to a pathologist, a doctor who specializes in examining cells and tissue under a microscope. They look at the pattern of the cells, how they're arranged, and whether they show any features of concern. Their findings become your pathology report. The first thing most people look for is one simple word: benign or malignant. Benign means non-cancerous. This is the most common result from a breast biopsy, and it includes things like fibroadenomas, cysts, or simple areas of fibrous tissue. Malignant means cancer cells were found. But there's also a middle category that trips a lot of people up, and that's atypical. Atypical findings are not cancer, but they show some unusual cell changes that suggest a slightly higher chance of developing cancer in the future. This is why atypical results are often taken seriously, sometimes leading to additional tissue sampling or closer monitoring going forward. If cancer is found, the report will usually clarify whether it's in situ or invasive. In situ means the abnormal cells are contained within the milk ducts or lobules and haven't spread beyond them. Ductal carcinoma in situ, often called DCIS, is the most common example. Invasive means the cells have grown beyond their original location into surrounding breast tissue. This distinction matters a great deal for planning next steps, so your doctor will explain what it means in your specific situation. You might also see a grade, usually numbered 1, 2, or 3. Grade describes how much the cancer cells resemble normal healthy cells under the microscope. A lower grade generally means the cells look more similar to normal cells and tend to grow more slowly. A higher grade means the cells look more abnormal. Grade is just one piece of information among many, and it doesn't tell the whole story on its own. Another section you might notice mentions receptors, specifically estrogen receptor, progesterone receptor, and something called HER2. These are proteins on the surface of cancer cells that can influence how the cancer behaves and which treatments might work well. Think of receptors like little switches that certain treatments are designed to target. Your doctor will use this information alongside everything else to help guide any treatment planning. If you had a larger biopsy or surgical removal, the report may also mention margins, which describe whether there's a rim of normal tissue surrounding the area that was removed. This helps the surgical team understand whether all of the concerning tissue was captured. Here's something important to remember. A pathology report is detailed and technical because it's written by one doctor to communicate precisely with another doctor. It was never designed to be read cold without someone there to translate it for you. That's completely normal, and it doesn't mean you're missing something obvious. So here's my practical takeaway. When you get your report, don't try to fully interpret it alone from an internet search. Instead, write down every word or phrase you don't understand and bring that list to your follow-up appointment. Ask your doctor to go through it line by line with you. A good appointment for reviewing pathology results should never feel rushed, so don't hesitate to ask for a few extra minutes or even a follow-up call if you need more time to absorb everything. Understanding your own results can help you feel more like an active partner in your care rather than a bystander waiting for instructions. And remember, this report is just one part of a bigger picture that your doctor is putting together alongside your imaging, your exam, and your personal health history. As always, this video is meant to give you general understanding, not to interpret your own personal results. Please talk to your doctor about your specific report and what it means for you. Thank you for watching, and take good care of yourself.